Hello, and thanks for joining us for this video case tip. I'm Brynne McBride of ABC for Health. Today we're taking a very quick look at the Patient Freedom Act of 2017. Now, this was just introduced at the end of January by 4 different Republicans. It's colloquially called the Cassidy and Collins Plan, and it's the most recent in the attempts to create a partial repeal and replacement of the Affordable Care Act. It's meant to appease both sides of the political aisle, and in the end, it kind of comes up short on both. It is meant to really focus on giving states enhanced flexibility and states' rights and responsibility, and delegate duties to the states while also doing a little bit of deregulation. Let's take a little closer look at what it's actually doing. It's granting power to the states to do one of 3 options. Keep the Affordable Care Act if they like it and they want it. If they like their Affordable Care Act, they can keep it. Adopt a different approach based on what they're calling Roth HSAs, Roth Health Savings Accounts. It's kind of like a traditional health savings account, only the way that contributions are taxed is a little bit different. And we'll take a little bit closer look at that in just a second. Or the state can reject reform altogether and go back to whatever they were doing before the Affordable Care Act. Those 3 options are written into the Patient Freedom Act of 2017, which makes it extremely complex. You have 3 different systems of healthcare and insurance delivery in place at the same time across the country. It's what this plan is envisioning. It only addresses Title I of the Affordable Care Act when it talks about repeal and replace. And this is the insurance reforms and affordability provisions. It doesn't talk about Medicare or different taxes or fees imposed by the Affordable Care Act, probably because it needs those to generate the revenue that it needs to put some of the subsidies and different parts of the financing of the plans in place. It also includes what they call an alternative Medicaid expansion that starts getting a little bit deep in the weeds, but it's based on their proposal of how this Roth HSA is in place as well. It's very complex. What would it do in short? Well, if you're one of the states that wants to repeal the Affordable Care Act, you would get rid of insurance reforms, things like tax credits and cost sharing reductions, the 10 essential health benefits, marketplaces. It does write in, however, that you would keep some of the provisions that the drafters of this bill like, dependent coverage, prohibition against pre-existing conditions, but it doesn't really prohibit high-risk plans from coming up. Anti-discrimination language is left in the plan, which is a little surprising because that's quite controversial. Section 1332 waivers, those are the innovation waivers, which of course they're going to leave in. That's a whole separate approach to repealing the Affordable Care Act in some regard by just giving a lot more flexibility and liberally defining what it means to have an innovation waiver. Just puts a lot more power in the hands of the states to determine what they want to do under the Affordable Care Act. And it actually keeps in place a couple other provisions of the Affordable Care Act as it relates to insurance provisions. What are these Roth health savings accounts that they're talking about? Well, it's determining how funds could be deposited into a health savings account. Either the federal government or a state could do it. It's the state's choice, again, is how this is written. They could be used to purchase health insurance and cover cost sharing. So it's a different way of distributing what might be called different subsidies and tax credits under the way the Affordable Care Act is operated now. Instead, it would implement health savings accounts and just direct some of the money into that could then be used to reduce the cost of the insurance that you're providing. They are taxable. Contributions to your health savings account would be taxable. There are other provisions for how they want it to look on the back end of the process. And it is rated on age and geography. So depending on where you lived would impact of the benefit of this health savings account. Now, traditionally, health savings accounts have been criticized as benefiting the healthy and the wealthy to the disadvantage of the low income and the health disparity populations. Roth HSAs are no different. You can read the Patient Freedom Act of 2017 if you would like to. There, we put the link. Senator Cassidy and Collins both have put this on their websites, but you can read it here by clicking on the information button. You can find this link and read the full text. I would recommend you read Tim Jost's Health Affairs blog post. It takes it provision by provision and summarizes it and breaks it down, especially if you want to learn a little bit more about what they're talking about when they say Roth health savings accounts. It'll give you a lot more detail. Share your ACA story with us. Click on that information button, send us an email, or share your story by visiting our website at healthwatchwisconsin.org.